Welcome back. We are starting things off with our first conversation for the morning. And as we mentioned, we are joined by Dr. Hidalgo with some great news. We really are happy to mention that he was elected as the president for the World Federation of Intensive and Critical Care.
Congratulations.
Congratulations, doctor. We have to give you your flowers and also say how the pride that we have knowing that you are from Belize. This is an honor not only for you but for Belize, I believe personally.
Yes, no, well, good morning and thank you for the invitation. And yes, indeed, no, it's for the first time that a country from Central America and the Caribbean is going to be elected as president of the World Federation of Societies of Intensive Care and Critical Care Medicine.
What comes with this title?
Yes.
Well, these titles come with a lot of responsibilities. But it's exciting times, no? I think so. COVID brought to the knowledge of everybody the importance of critical care and intensive care medicine, and that's basically goes also in hand to just the World Federation. If you see the World Health Organization also realized the importance of emergency intensive critical care medicine. And I think so what is coming is a lot of work.
Yeah. I just want to take things back really quickly and talk about the World Federation of Intensive and Critical Care.
Yes.
Can you talk about what this body is and what it represents?
Yes, the World Federation of Societies of Intensive and Critical Care Medicine basically was created, the idea was created in London in 1971 and was officially, and at that point was the first meeting in London and was officially a body in 1981. Actually, the first president of the federation was Dr. Villazón from Mexico.
Okay.
And then since then we are working. The federation have 86 countries, and of course more and more are coming, especially with this new that awareness of the importance of intensive and critical care. I mean that many other countries are joining the federation. Actually, we will have our General Assembly just the 14th of June.
Mm-hmm. That's a lot of countries that are on that body. I just want to say you said 86.
86. Right.
That's majority.
Yeah.
But let's talk about how you were able to be elected. What was that process like?
Yeah, I started work with them since 2008, initially as with collaboration efforts. Then lately we create, just for academic purposes, the Belize Society of Critical Care Medicine.
Mm-hmm.
We've been doing trainings, and then we joined the World Federation as a member in 2012. Mm-hmm. And since then, I keep working with them. In 2019, I was elected as a member of the board, and I was elected as a Secretary General. In 2021, I was elected as a president-elect, and then right now in August, this coming August in 26, I will assume as a president.
Nice. Yeah. Now, in terms of the members of the Belize Association, talk to us about how many persons or how many doctors are part of that. Are they from the private sector only, public and private sector?
Well, that's a very interesting question, and also is also something that it makes us proud to be part of the World Federation. We have as an intensivist, we are only 3 intensivists in the country.
Wow.
Dr. Cuellar and Dr. Pedro Arriaga.
Okay.
And actually, one of the things is, Dr. Cuellar was the first intensivist that came to the country of Belize. I came into Belize in 2002, and we built the first intensive care unit that at that point Universal Health Services, that now is Belize Healthcare Partners. And in 2007, we was part of the Carl Hughesner Memorial Hospital, and along with Dr. Arriaga, we built the first intensive, we created the first intensive care unit at Carl Hughesner that was inaugurated in 2012. And since then, we basically do several training courses in collaboration with many other organizations, like the American Society of Critical Care. And one of them is the fundamentals of critical care medicine. We just did one recently, and we are scheduled to do other training.
So this World Federation of Intensive and Critical Care organization, basically it's an information hub. You get to share information, practices, experiences in terms of offering critical care and intensive care.
Yes, that's the advantage of belong to an organization like that is the accessibility to resources. There are many other countries with more resources, and normally they want to share experiences, volunteer, and also not only for countries like us, but also there are several other countries with major needs than us, and also we are to support those countries. No?
You know, I really want to touch on your expertise as a doctor. I have to say, Dr. Hidalgo, you are a part of families for so many people that you have helped. We had you on set last month when we were talking about lupus awareness, and it's really representative in conversations how much you have impacted the lives of persons that needed the help of a medical practitioner. Let's talk about your specialty as a doctor and where your passion really lies.
Yes, well, my when I completed my medical training, I did as a postgraduate and my postgraduate on internal medicine.
Internal medicine.
And when I completed my internal medicine residency program, then I also did 2 additional years on critical care medicine. That is what we usually do, but normally, because the type of work we do in those countries, we usually combine the two, the internal medicine and intensive care. And that's essentially what we do, and we are passionate about it.
Yeah.
You know, I just go back to, and while we're, WHO just recently, you know, announced that, oh, you know what, the COVID is no longer a pandemic. But I go back to COVID-19 and when there were people getting this critical care of when they were intubated and all of that, and how, you know, some felt like, you know, it was like signing a death sentence because you're not sure if after you're intubated you're going to come out of that, you're going to survive it. Some did, some didn't. But let's talk about that, how COVID really pushed you guys, at least critical care, to another level.
Yes, well, as this is was an important time in history, you know, but it also create awareness of the importance of the intensive care people, the time that the different people, the intensive care unit is not the work of only one person, is the work of a team that is a team that basically is comprised with people, the intensivists, nurses, respiratory therapists, and physical therapists, nutritionists, pharmacists, and the additional allied healthcare personnel. Mina, this is when we need to have a critical ill patient in the ICU, and we see that we are able to help for these people to continue the life, then is something that makes us happy as a team.
Yeah.
And COVID-19 was part of that, no? Because was different in the sense that not only the patient wasn't admitted to the intensive care, but also isolated. No? remember that at those days, nobody was allowed to be in the ICU.
Anywhere close.
I love that we can look back and say those days now, you know, like it's getting further and further in history, and we don't have to think about it as so close, you know. I really want to touch on the fact, though, that you mentioned that there is 86 countries that are a part of this body, and we're looking at modern hospitals or persons that are working in modern hospitals, first world countries. You have the ability to interact with medical practitioners that have access to a wealth of resources and machinery that makes their type of work when it comes to intensive care so much easier. As the president of this federation, is there anything that you would like to see be specifically improved in Belize when it comes to intensive care?
Well, the most important thing, I think so, is that we need to create, again, develop capacity and create more opportunities for people to go and train as an intensivist. Also, the nurses, the more respiratory therapists. Of course, we have a very good team of pharmacists in the country, but we need to develop that capacity. You know? We need to create more opportunities for people to be able to train in those areas, because one of the things we need to learn from the pandemic is that this is not over. No, we are anytime we are going to have a next pandemic, and hopefully we be able to be more prepared.
Yeah.
You know, one of the things that happened during the pandemic also was, and I think Sabrina alluded to it, it's access to the equipment needed to offer that critical care. How do we, is there need for additional investments there to get the equipment that we need to offer critical care, you know, at its best?
Well, you know, that's a good question, because if one of the first things we were concerned at the beginning of the pandemic is how many ventilators we have in the country. But then that comes with another question: how many people are skilled on manage and try be able to work with the ventilator? No? I mean, I think so. Everything goes hand in hand. We need to be able to develop the skills of our personnel to be able to manage the equipment. And we there are many people now that are came back to the country, and they are working at different areas in the public and the private sector. But I think so it's important that we need to continue develop capacity and give opportunities to the people to get trained.
Yeah.
This is across the sectors, right? Because I know a lot of people tend to believe that, you know, there's better critical care services in the private sector, you know, at private health facilities as opposed to the public sector. Is this the case? I know you said that earlier that, you know, you were part of setting up the first intensive care, critical care unit at Universal, now Belize Healthcare Partners, but you were also instrumental in setting up the one at the KHMH. So is there a better service in the private sector than
the intensive care unit at Calhoun is really well equipped, no? And is led by Dr. Arriaga, and they have a very good team there.
Yeah.
Yes, I mean, I think so. If we look back and how the services was done many years ago, and how the services has growing those days, they have a very good services there. Of course, the situation is the only intensive care unit for a public. No?
Yeah.
I mean that the demand of a bed in ICU is very high. No? Most of the time they are it's a 7 beds unit for the entire country. I mean that it's very difficult to get access to a bed sometimes. No? I mean that one of the things we were discussing also in the pandemic is that sometimes we need to decide and to choose who is going to be able to access a bed. No? I mean, that those probably are very difficult moments for us as a physician, because of course we would like to provide service to everyone, but sometimes we need to decide who will benefit more from a bed.
So in this capacity as president, would you be able to maybe work hand in hand with the government to see how funds can be sourced, or investments can be made to build the capacity of other, even if not the KHMH, to build the capacity of other health facilities so that they can too now have an intensive care unit? Because I think maybe that is a solution to the problem, to have more facilities available with this particular service.
Yes, the problem with the, as I told you, the intensive care unit is everything we need to be planned, and I think so we are more than happy to help on that. That we need to think on, or we need to have a projection on we're going to develop an ICU, but also with that it comes that we need to develop the capacity of personnel. That way, when this unit is open, we know that we not only have the ability to the unit to be equipped, but also we will have the skilled personnel to manage that.
And I really want to go back to that point right there, because essentially you were mentioning that human resources is equally as important as equipment.
Exactly.
And if we're honest, we're looking at a situation where a lot of persons that are nurses are seeking better opportunities overseas, and I imagine it to be very similar with medical practitioners such as doctors. Do you see this to potentially be an issue in the future, where we run a risk of competing with first world countries that are hoping to employ our persons here that are trained?
Well, it's already happening, no? And not only for Belize, but it's a situation around the world where like all the medical personnel, nurses, and physicians are basically scared, no? And everybody is looking for new opportunities, and that is not a secret, no? I mean, that, I think so. Also, that brings that issue that also we need to think on properly compensation for the different activities, and also for the hours we need to put in different areas, no? I mean that that's critical, no? We need to try to motivate and give incentives to our people and recognize the work, no? We need to recognize the effort that everybody does, and I think so that is critical to keep them motivated. No?
Yeah.
Agree.
You know, Doc, I want to touch on something that might be a little bit more personal for you, because you are a well-recognized physician, not only locally, but overseas as well. How is it in terms of balancing your life and your work? To be able to become the president of a world federation must have required a lot of investment in time.
Yes, no, that is that's critical. I've been already experienced it as the president-elect, because we need to go to different countries, and now, of course, as we mentioned at the beginning, more responsibility.
Yeah.
I mean that we need to balance our work and family.
Yeah.
And also to represent the presidency. But what we did is we have a board, a council. Is a total of 13 persons of us. Then we're trying to share that burden, that responsibility.
Okay, so it's not as bad on the family. I mean, I wonder, because I remember one of the segments that we had when we were talking about lupus, and they said, you are such a great doctor that they're calling you, all throughout the night, and you care about your patients. So I can't imagine how that must feel as someone that's so passionate about helping people with their health, and balancing your own life, you know, and now having an additional
Yeah.
responsibility. You're trying to save us all.
It's challenge for us as a physician, no? Because we have a great responsibility. But also, we're happy to do that. No?
Yeah.
We are passionate and we enjoy what we do.
Yeah.
How do we get more people to go into this field of work? Because we only have 3 in the country. We need more than 3. So how do we get them interested in this?
Well, there are a new younger generation of doctors that are coming into the country, and they are motivated. Some of them are having or trying to do many other specialties, either cardiology, emergency medicine. We have new people that they just come back into the country, and there are many other people already getting trained in different other areas. No, we hope that also intensive care is one of them. And I believe, as I told you, the pandemic brought the importance of intensive care, and I think so. Also, we need to trying to invest and trying to see how people get motivated on that, not only for as a physician, but also nurses to get that training in intensive care.
Talk to them right now and tell them why they should try to do some kind of training in intensive
Well, like
care.
the intensive care is a very demanding specialty, very rewarding specialty as well. And I believe as the country is growing, the offer of services is growing. It's critical that also we need to fill those spaces and that we get more intensivists as a doctor, nurses, respiratory therapists to be able to serve in those areas of need.
You know, Doc, I wanna lighten the conversation with something that, you know, if you're a fan of doctors, you might watch the TV shows that are, you know, involved with doctors, and one of the big ones is Grey's Anatomy.
Yeah.
Is it accurate? That has a lot to do with intensive care. Do you happen to watch shows like that and think that's not what happens? Let me know.
I like that.
Well, some of the things that they're trying to apply to this reality, but sometimes it's not that easy.
Yeah, because I'll tell you, I mean, some TV shows I watch and I get so inspired. I watch Grey's Anatomy and I think, look, I'm a surgeon, okay? Give me my scalpel.
You could do this.
or you watch How to Get Away with Murder and you're thinking, I'm an attorney. I watch Suits.
Yeah.
So do you think, you know, watching TV shows like that and getting inspired, do you think that that's,
Well,
you
you know,
know, something we can't expect in the field?
Well, you know, the ER that was also
yeah.
a show of that, at that moment also create a lot of motivation for people, and they went into the ER, and in a way motivate people to go and get
Do
training.
medicine, yeah.
Of course, we know that some things are not that easy,
Yeah.
but it motivates people. And
I always wondered, though, if doctors here watch those TV shows and think that's not even the right step. You're not supposed to do that first, you know? But I had to ask you that because I figure that that's something that, you know, people might ask you sometimes. But we definitely want to say congratulations to you, and we can't wait to see, you know, the impact that Belize will have on such a recognition, just having you as the president of this federation. And I can't wait to learn about the information that is shared among you medical practitioners, and of course an opportunity for persons here that are interested in joining the medical field to look at an example of where one can become.
exactly.
Yeah,
Yeah.
I like that.
Yes, we definitely want to say thank you. Do you have any last words as it relates to medicine here in Belize and just the work that you do?
No, thank you. And I think so, if I'm just looking back when I came to Belize in 2002 and now, I know there are too much things to do, but definitely from the last 20 years, Belize is grown tremendously. The offer of services is is definitely there. There are more things that we need to learn, and also areas that we need to grow. But I think so if we work hand to hand as a team, as an effort, definitely, hopefully in the next 10 years we'll be in a different position.
Awesome.
Wonderful. Thank you very much.
You.
Perfectly put, Doctor. We thank you so much for joining us this morning, and we can't wait to see what else you do.
Thank you.
All right. We're going to take a break, and when we come back, we'll be joined by the WCS and CRFM to talk about Fisher Folk Month. Don't go away.